So to begin, would you like to give maybe an overview of how you extracted your data and just highlight and summarize on what you found?
Thanks, Jordan. So basically, in 2020, we conducted a study using a real world data set, which is US based, known as Flatiron Health Electronic Health Records. And in that, we found that less than 40% patients with metastatic hormone sensitive prostate cancer receive a combination therapy or intensification therapy, which we defined as ADT with androgen receptor pathway inhibitors or docetaxel or both. So this was kind of a continuation of this study looking at the more contemporary data because after we looked, there were multiple other clinical investigators, including Dr. Friedland, Dr. Heath, who have looked into various data sets and in the US-based real-world patient population, and they found that the use of intensification or combination therapy in metastatic hormone-sensitive prostate cancer is less than 50%. So for this IRB-approved retrospective study, we again used the de-identified nationwide Flatiron Health electronic health record derived database to extract patient-level data. So this database originates from approximately 280 US-based cancer care clinics or 800 sites of care. And for this study, we use the eligibility criteria that the patients need to be diagnosed with metastatic hormone-sensitive prostate cancer, and we should have availability of information with regards to what systemic therapy they received. The data cutoff date was May 31st, 2024 for our study, and patients for this study were diagnosed with metastatic disease between January 1st, 2013 to May 15th, 2024.
That's amazing. And, when I was reviewing your data, I did see, and correct me if I'm wrong, about 70%, or even closer to 80% of patients actually did receive intensification or what we call combination therapy with either a doublet or a triplet. Is that correct?
Yes, absolutely. So for this study, overall, our study cohort was 24,105 patients with metastatic prostate cancer, of which 14,084 patients met the eligibility and were included in the analysis. The median age of our cohort was 72 years, and most of them were white non-Hispanic patients, and most came from community practices. So when we looked at our data set, from 2013 to 2017, ADT monotherapy was the most commonly used therapy, which was approximately 78%. But as the years passed by, the use of intensification picked up. And if we look at the data from 2023 onwards, we found that approximately 77% of the patients were receiving ADT intensification, which could be ADT with androgen receptor pathway inhibitor, or docetaxel, or triplet therapy, which includes ADT with an androgen receptor pathway inhibitor with docetaxel. And at the same time, the use of ADT intensification, which I just mentioned, that was approximately 78% before 2017, decreased to 17% after 2023.
So that's fantastic. No, thank you so much for your work. We've had numerous trials looking at intensifying therapy, doublet compared to single agent ADT monotherapy, and more recently, triplet therapy for some patients. And we know that there is improved overall survival as well. So to see that now only 20% from your data set, specifically after you said 2023, so about 1 in 5 patients now are receiving ADT monotherapy, is a significant improvement. So I think it's very important to really highlight this.